Have you ever owned or cared for a large animal? Then you've almost certainly heard the word colic
Oh, yeah.
and probably felt that familiar nod of concern right in your stomach.
Absolutely. It's a word that gets your attention.
But here's one of the first surprising things we found prepping for this deep dive. Colic isn't actually a specific disease.
Right. It's more of a clinical sign, isn't it?
Exactly, a
Yep.
broad term for abdominal pain. And that fundamental idea applies even to animals we might not think about as often in this context, like, llamas and
Or
alpacas.
farm deer and elk.
Or farm deer and elk, yeah. So today we're taking a deep dive into the complex and often really life-threatening causes of abdominal pain in these incredibly unique species.
And our mission really is to shine a light on the critical differences between them.
Yeah, the anatomical, the physiological distinctions between camelids and cervids, because they lead to vastly different causes, different signs, different ways you diagnose and manage colic.
Totally different approaches needed.
We want to arm you with the surprising facts and the crucial insights you need to be truly well informed on this.
And this is all pulled together from, expert veterinary guides, comprehensive overviews. We've tried to get the most important nuggets for you.
It really is striking how colic is just the beginning, isn't it? It's not the diagnosis itself.
Exactly. It's a call to action,
Yep.
time to investigate.
Mm-hmm.
And that investigation looks dramatically different depending on whether you're looking at a camelid or a cervid.
Absolutely. And the first major hurdle, I guess, no matter which animal, is actually recognizing that they're even in pain. That sounds harder than you'd think.
It really is.
Yeah.
Because camelids and cervids, they're prey animals, fundamentally.
Right.
So they have this deeply ingrained instinct to hide any sign of pain or weakness. It's pure survival. Don't signal vulnerability to predators.
Which is so different from horses, isn't it? They can be so dramatic.
Oh, completely different. Horses often show, dramatic, sometimes violent signs: rolling, thrashing, sweating profusely.
Yeah.
These guys, they're trying to be stoic even when they're in agony.
So if they're not putting on a big show, how do you even know? What are these subtle signs we should be looking for?
Well, the indicators are often subtle, easily missed. Early on, it might just be behavioral changes.
Like what?
Like suddenly losing interest in feed, withdrawing from the group, being lethargic, maybe restless, or adopting weird postures.
Okay.
You really need a keen eye and a good understanding of what's normal for that animal to catch it early. Recognizing those subtle cues is often the first and maybe the most critical step.
That really drives home why understanding their biology is so vital. Which brings us to this profound anatomical and physiological divide you mentioned. Why is that the most critical factor here?
Because this evolutionary split means they have fundamentally different digestive systems. And if your clinical approach doesn't recognize that difference, well, it's just not going to work. It could even be harmful.
Okay, so let's break that down. Cervids versus deer, elk. They're true ruminants.
Yes, exactly. Like cattle or sheep. So border ruminantia, they have that classic four-compartment stomach.
The rumen, reticulum, omasum, and abomasum.
Got it. Precisely. And their forestomach, the part that handles the initial digestion, it's lined with this tough non-glandular stuff.
Yeah.
Keratinized epithelium.
So they're good at digesting rough forage.
Incredibly efficient at it. But that system also makes them prone to specific issues like bloat and, critically, a condition called rumen acidosis, grain overload.
Ah, okay.
It happens fast, very severe, and their motility pattern is craniad to caudad. Head to tail, food moves pretty much straight through.
But camelids, llamas, alpacas, they're pseudo-ruminants. How is their stomach setup different?
Totally different. They're in the suborder Tylopoda. They have a unique three-compartment stomach, C1, C2, and C3.
3, not 4. What are they missing?
Crucially, they lack an omasum. C1 is the biggest, kind of like the rumen, but big fermentation vat, but it has these special glandular areas for absorption too. C2 is smaller, also involved.
And C3.
C3 is this long tubular organ, and the final part of it, maybe the last fifth, has true gastric glands. It secretes acid and enzymes, making it functionally like the abomasum, or, our own stomach.
And you mentioned their motility is different too, almost backward.
Exactly right. Their forestomach motility is caudad to craniad, tail to head.
Huh.
This pattern is amazing at mixing the contents. It makes them remarkably resistant to bloat, unlike true ruminants.
No, there's always a but.
But the acidic environment in that final part of C3 makes that specific region really susceptible to ulceration, especially under stress.
Okay, so already we're seeing totally different vulnerabilities based just on anatomy. What does this mean for the types of colic they get?
You've nailed it. That's the core insight. These anatomical differences lead straight to physiological differences. Camelids, for example, keep a higher, more stable pH in C1 compared to a deer's rumen.
Which helps digestion.
Yeah, it boosts the activity of their digestive microbes, lets them handle poor quality forage better. Plus, they're more efficient at recycling urea, conserving water, adaptations from their ancestral arid homes.
So the takeaway is,
The key takeaway is this. While a farmed deer might get really sick really fast from eating too much grain, a llama is way more likely to show colic signs because of a C3 ulcer, or maybe a blockage in its spiral colon, which is also unique.
so the vet's first thought process has to be totally different.
Absolutely. Faced with a colicky deer, you're thinking rumen, maybe check the pH. Faced with a colicky alpaca, you're reaching for different tools like an ultrasound to look at C3 in the intestines. The first step always is knowing. Am I dealing with a ruminant or a pseudo-ruminant?
That distinction is just fundamental. Okay, so knowing that, let's dive into the camelids first, llamas and alpacas. You said abdominal pain is pretty common.
Very common. Digestive issues make up about a quarter of all illnesses reported in them.
Wow.
And yet tackling it requires knowing their unique anatomy and how subtly they show pain.
So what are the big GI causes? You mentioned C3 ulcers are a major one, like their version of a stress ulcer.
Pretty much, yeah. C3 ulceration is a primary frequent cause, and it's strongly linked to stress, just like people get stress ulcers.
What kind of stressors?
Oh, things like transport, going to shows, being
Mhm.
hospitalized, weaning, changes in the herd, being separated, even just being sick with something else.
And how bad can it get?
Signs can range from just mild kind of intermittent discomfort all the way to severe pain. And if that ulcer actually perforates, burns through the stomach wall, that leads to septic peritonitis, infection in the abdomen, and that's rapidly fatal.
Scary. What about blockages? You mentioned bizarres earlier. Sounds like something out of Harry Potter.
Doesn't it? They're basically concretions, like stones, of indigestible stuff that forms in the gut.
Made of what?
Trichophytobizars are really common, especially in young ones under a year old. They're made of hair and plant fiber.
Why would they form?
Risk factors include things like lice or mites causing excessive grooming, maybe boredom, or even cryas continuing to suckle after weaning. These things tend to get stuck at narrow points, the exit of the stomach, the start of the small intestine, or those tight turns in their spiral colon.
Are there other kinds of obstructions?
Less common, but yeah, you can get impactions of the small intestine with tapeworms sometimes. Or C1, the first compartment, can get impacted with really coarse, fibrous feed, especially if they don't drink enough water or have dental issues. Foreign bodies too sometimes.
And what about the really scary stuff like intestinal twists? Those are emergencies in horses.
Same here. Intestinal strangulation and torsion are definitely surgical emergencies. The blood supply gets cut off. The most common cause is something called a mesenteric root volvulus. The intestine basically twists around its own blood supply.
Ouch.
Yeah. Other causes are things like entrapment through natural openings in the abdomen, or maybe defects in the body wall, or adhesions from previous issues. Intussusception, where one bit of intestine telescopes into the next, is rarer, but it happens.
Okay, so ulcers, blockages, twists. What about infections causing gut inflammation, enteritis?
Definitely. There's a specific parasite, Eimerium acuseniensis, that's a big deal in camelids.
How's it different?
Unlike other coccidia, this one invades deeper into the intestinal wall, causing severe inflammation, protein loss, and colic. And the tricky part is the animal often shows signs before it starts shedding the parasite eggs in its feces, so it can be hard to diagnose with just a fecal sample early on.
It's sneaky. Any other bugs?
Oh yeah, the usual suspects can cause diarrhea and discomfort too, especially in young or stressed animals. Viruses like rotavirus, bacteria like E. coli, salmonella, yersinia, and other protozoa like giardia.
Can problems outside the gut cause colic signs too? Like, a bladder issue or something?
Yes, definitely. Urogenital problems are on the list. Uterine torsion and twisted uterus is actually a relatively common cause of acute colic in pregnant females, especially near the end of pregnancy. Also, difficult birth or severe bladder distension if there's a blockage preventing urination. Even liver or kidney problems can cause pain if the organ swells and stretches its outer capsule. Think fatty liver disease, hepatitis, or kidney distension. Those usually cause milder, more chronic signs, though.
So, given how subtle the signs can be, how do you actually spot colic in a live camelid during an exam? Sounds like detective work.
It really is. Careful, patient observation is key. The signs are often intermittent, subtle, much more like cattle than horses.
Does age make a difference in how they show it?
Huge difference. Crias and juveniles, say under 6 months, are more likely to show obvious signs of acute pain, kicking at their belly, rolling, flashing around.
Okay, more dramatic.
Yeah. Adults, though, typically display much more subtle signs. You often need to just watch them quietly for a good 15 minutes, maybe even up to an hour.
So what are those typical adult signs a vet looks for?
Restlessness is a big one. Getting up, lying down, getting up again. Abnormal postures, like lying stretched out flat or maybe with their head and neck arched back over their body.
Weird positions.
Yeah. Or adopting an unusual cush position for a long time, or standing hunched up. Vocalizations too, grinding their teeth, that's called bruxism, or groaning. And just behavioral changes, being depressed, off their feed, straining like they need to poop or pee, flagging their tail up and down.
Yeah.
All clues.
And the hands-on physical exam, what are you checking beyond just watching?
A systematic exam is crucial. Check the basics. Temperature, heart rate, respiratory rate.
What's normal for them?
Roughly. Tempo, 99.5 to 102 Fahrenheit. Heart rate, 60 to 80 beats per minute. Respiratory rate, 10 to 30 breaths per minute. But here's a key point. A high heart rate, tachycardia, isn't as reliable an indicator of severe pain or needing surgery in camelids as it is in horses.
Interesting. Okay, what else?
You look at the abdomen for distension, feel it gently. You can listen with a stethoscope while tapping the abdomen, pinging that helps detect gas-filled organs. In larger animals, a rectal exam might be possible, but there's a risk of tearing the rectum, so it needs care and experience.
Can you give us a quick, if you see this, think that for common causes?
Sure. So for C3 ulcers, think poor appetite, depression, teeth grinding, on and off colic, maybe black, perifeces, that's melena, digested blood,
Okay.
duodenal obstruction, like from a bezoar, often acute severe colic, maybe regurgitation, off feed, getting progressively depressed, especially in young ones. You might even feel a lump in a cria's belly.
Spiral colon obstruction.
That's usually more gradual. Mild to moderate colic, fewer droppings than none at all, belly starts to look distended.
And that parasite, Eimeria macusaniensis.
Think poor condition, weight loss, intermittent colic, maybe diarrhea, but not always. Often they look unthrifty, maybe have that swelling under the jaw, bottle jaw, from losing protein.
Lastly, uterine torsion.
Acute onset, moderate to severe colic, restless, straining, in a female that's heavily pregnant. A vaginal or rectal exam usually confirms a twist.
With signs being so subtle, diagnosis can't just rely on the physical exam, right? What's the workup involved?
No, you definitely need more. The main goal is to figure out, is this something medical we can manage conservatively, or is it a surgical emergency needing immediate action?
So blood work.
Standard colic workup includes a complete blood count, CBC, fibrinogen for inflammation, and serum chemistries. And here's another key difference from true ruminants.
The physiology again.
Right. Cattle with a blockage high up in the intestine almost always get this specific electrolyte pattern, low chloride, metabolic alkalosis. But in camelids, it's not consistent.
Why not?
Because all three of their stomach compartments can absorb things, so they can partially compensate for electrolyte losses. However, one thing that is common and important in camelids with obstructions is low potassium hypokalemia.
That's a really crucial detail. What's the most valuable non-invasive test then?
Without a doubt, transabdominal ultrasound, especially helpful in alpacas and crias, too small for a rectal exam.
What can you see with ultrasound?
The key finding, suggesting a blockage or ileus, where the gut stops moving, is seeing multiple loops of intestine that are dilated, usually bigger than 2 centimeters across, and filled with fluid. Ultrasound can also show thickened intestinal walls, like in enteritis, or focal thinning suggesting a C3 ulcer, or excess free fluid in the abdomen indicating peritonitis.
What other tests might help? Ancillary diagnostics.
Abdominocentesis, the belly tap, is very useful. Analyzing that peritoneal fluid. If the cell count is high, say over 3,000 cells per microliter, or the protein is high, over 2.5 grams per deciliter, it suggests inflammation or compromised bowel.
Okay.
Also, analyzing fluid from C1, the first stomach compartment, collected via a tube. If the chloride level in that C1 fluid is high, say over 40 millieq per liter, it strongly suggests a blockage further down, like in the duodenum, because chloride-rich fluid is refluxing back.
Makes sense. What about x-rays?
Less useful in adults because they're just too big, but definitely valuable in crias. Plain x-rays might show gas patterns pointing to an obstruction. Contrast studies where they swallow dye can help pinpoint the blockage.
Okay, so once you have a diagnosis or a strong suspicion, how do you treat these conditions?
Well, it really depends on the cause and how severe it is. Medical management works for things like enteritis, mild impactions, gastric ulcers, things that aren't blockages.
What does medical management involve?
Fluid and electrolyte therapy is absolutely key. Correcting dehydration and those electrolyte imbalances, especially the low potassium.
Pain relief.
Yes, nonsteroidal anti-inflammatories, NSAIDs like flunixin, miglumin, but very important, needs to be given intravenously. The oral forms are just not absorbed well in camelids.
Right, you mentioned that before.
Yeah, and the opioid butorphanol can give short-term pain relief and some sedation too.
How do you specifically treat C3 ulcers? You said oral omeprazole, the common horse treatment, doesn't work well.
Correct. Oral omeprazole paste, like Gastrogard, has incredibly low absorption in camelids, estimated around only 3%. It's unlikely to be effective.
So what do you use?
The treatments of choice are injectable proton pump inhibitors, drugs like pantoprazole or compounded omeprazole, given either IV or under the skin. Sucralfate, a stomach coating agent, can also be used, sometimes preventatively in CREAS after surgery.
When does it become clear that surgery is needed? That sounds like a huge call.
It is a big decision, but often a critical one for survival. Surgery is indicated by a combination of things: severe, persistent pain that doesn't respond to painkillers, seeing distended, non-moving intestines on ultrasound or exam, abnormal fluid from a belly tap, or if the animal hasn't passed any feces for more than 24 hours.
And timing matters.
Hugely. The surprising truth is that early surgical intervention is critical for a good outcome. Waiting until the animal is really weak and debilitated dramatically worsens the prognosis.
What does the surgery involve?
The standard approach is a ventral midline ciliotomy, an incision along the belly midline for an exploratory laparotomy. This lets the surgeon systematically examine everything inside the abdomen. Common procedures are an enterotomy, which is cutting into the intestine to remove a bezoar or impaction, or a resection and anastomosis, where a damaged section of bowel is removed and the healthy ends are sewn back together.
And recovery. I imagine post-op care is intense and there are risks.
It absolutely is. The postoperative period can be challenging. A big concern is postoperative elesis. The gut just doesn't want to start moving again. Incisional infections or hernias can happen, and diffuse peritonitis, a widespread abdominal infection, either from the original problem or surgical contamination, is unfortunately a frequent and often fatal complication.
Any unique risks for camelids?
Yes, because of their long, soft palate, they are obligate nasal breathers. This means regurgitation during anesthesia with subsequent aspiration pneumonia is a serious risk we have to guard against.
What's the overall outlook? Prognosis?
It's generally guarded. A recent study, I think from 2025, reported about a 58% survival to discharge rate for camelids needing surgery for suspected proximal gut obstructions. The prognosis was significantly better for simple bizarre removals compared to things like intestinal perforations. Timely referral and surgery are really the most important factors for survival.
Okay, let's shift gears completely now to cervids, farmed deer, and elk. You said the picture of colic here is often dramatically different, more of a herd issue.
That's exactly right. While, sure, an individual deer can get an ulcer or something, the most significant, most economically damaging causes of acute abdominal disease in farm cervids are usually herd-level problems, and they're almost always tied to diet and management.
And it presents differently, too, not always colic signs.
Often it manifests as just sudden peracute illness and death, rather than a long period where you actually see colic signs.
So what are these sudden, devastating causes that producers might face?
The most common, most damaging things are metabolic and dietary emergencies, almost always linked to sudden access to easily fermentable carbohydrates.
Like grain.
Exactly. Grain overload or rumen acidosis happens when ruminants that aren't used to high-concentrate diets suddenly get into a load of grain. Corn is classic, or maybe apples, other fermentable feeds.
What happens in the rumen?
Rapid fermentation kicks off, leading to a massive bloom of lactic acid-producing bacteria. The rumen pH plummets, often down to 5.0 or even lower. This kills off the normal microbes and basically causes a chemical burn on the rumen lining.
And systemically?
The high acidity draws huge amounts of fluid into the rumen, causing severe dehydration. Plus, the absorbed lactic acid leads to profound metabolic acidosis systemically, cardiovascular collapse, and often death within, say, 24 to 72 hours. It's incredibly fast.
Wow. And the other big one you mentioned, Clostridial enterotoxemia, overeating disease. How's that different?
Also triggered by a sudden carbohydrate overload, but the mechanism is different. Here, excess starch reaches the intestine, providing fuel for Clostridium perfringens bacteria to multiply rapidly.
And they produce toxins.
Yes, potent toxins. These get absorbed into the bloodstream, causing widespread damage to blood vessels, severe hemorrhagic enteritis, basically bloody dying intestines, and rapid death from toxemia.
Are there infectious gut bugs in cervids too, like we discussed in camelids?
Yes, definitely. Bacterial causes like E. coli and salmonella can cause diarrhea, especially in fawns. In older deer, there's yersiniosis, caused by Yersinia pseudotuberculosis. It causes enteritis and death, often triggered by stress, like transport or bad weather.
What about chronic issues?
John's disease affects adult deer too, causing chronic wasting and diarrhea. And viral diseases like EHD and blue tongue, spread by midges, primarily cause fever and hemorrhage, but they can also cause bloody diarrhea and severe illness that might look like colic.
Parasites.
Yep. Heavy burdens of gutworms or coccidia can cause poor growth, diarrhea, and pain, especially in young or stressed animals, just like in other livestock.
Do deer get stress ulcers too?
They do. Similar factors as in camelids overcrowding, social changes, frequent handling in farm settings. Signs are often vague, though. Poor appetite, rough coat, maybe diarrhea.
So what's the sort of clinical reality for a deer farmer? It sounds like it's often less about seeing colic and more about finding dead animals.
That is the critical and often heartbreaking reality. The most devastating causes, grain overload and enterotoxemia, frequently kill so quickly that colic signs are minimal or missed entirely. A producer is much more likely to find an animal dead, often one that looked perfectly healthy the day before, than to witness a prolonged colic episode.
And that changes everything for the vet.
Completely. It shifts the focus immediately from treating an individual to investigating a potential herd-wide emergency.
So if a deer does show signs, it's often really late stage.
Precisely. If you do see signs, they're often nonspecific. Depression, not eating, weakness, diarrhea, maybe lying down and unable to get up. And deer are masters at hiding illness. By the time it's obvious, the disease is usually critically advanced. Sometimes you even see neurological signs like staggering or convulsions with severe acidosis or enterotoxemia.
So how on earth do you approach diagnosis if the animal might already be gone or dying fast?
Yeah, it's tough. For farm cervids, honestly, a timely and thorough postmortem exam, a necropsy, is the single most important diagnostic tool. It's crucial for figuring out the cause of death and guiding how to manage the rest of the herd.
Trying to diagnose a live, sick deer is hard.
Extremely difficult and often unrewarding in these acute scenarios. The history is key. Finding out about potential access to excess grain is probably the most valuable clue. You can run fecal tests, but results often come back too late to help in an acute crisis.
So the necropsy tells the story. What are the key findings you'd look for in these big ones?
For grain overload, the rumen will likely be full of grain, the pH will be very low, under 5.5, and you'll see characteristic dark red or black erosions and bleeding on the lining of the abomasum.
And for clostridial enterotoxemia?
The classic lesions are segments of the small intestine that are severely hemorrhagic and necrotic dark red dead tissue, the bloody gut. You also often find excess fluid around the heart, in the chest, and in the abdomen. The kidneys tend to get soft and break down quickly, hence the name pulpy kidney disease. Finding the actual clostridial toxins in the gut contents confirms it.
Can necropsy show other things too?
Sure, it might show signs of infectious enteritis or find ulcers if those were the primary cause, especially if one perforated.
Given how fast these diseases hit and how hard it is to treat a sick deer, is treating individuals usually effective?
Honestly, it's often unrewarding. The disease progresses so rapidly and severely. If you try, it involves really aggressive supportive care IV fluids to fight dehydration and acidosis, maybe antibiotics like penicillin. For clostridial disease, there's an antitoxin, but it really only works if given incredibly early, which rarely happens.
And the stress of handling doesn't help?
Exactly. The stress of catching and treating an already critical animal can sometimes do more harm than good.
So it really comes down to prevention in these farm settings.
Absolutely. Preventive herd strategies are the only truly effective approach. Feed management is number one.
But how so?
Any introduction of concentrate feeds must be gradual, at least over 3 weeks, to let the rumen microbes adapt safely. And feed stores have to be securely fenced off. No accidental breakouts into the grain bin.
What about vaccines?
Vaccination is crucial for preventing enterotoxemia. Using those multivalent clostridial vaccines, the 7-way or 8-way types used for cattle and sheep, is a cornerstone of prevention.
And basic husbandry.
Still essential. Clean environments, clean water, avoiding overcrowding, minimizing stress, all help prevent infectious outbreaks and reduce those stress-related ulcers.
This deep dive really hammers home how incredibly different these two groups, camelids and cervids, are when it comes to colic. Let's maybe recap some of the biggest differences.
Yeah, the contrast is stark. I think the fundamental difference is the focus. Colic in a llama or alpaca, usually an emergency for that one animal. The goal is diagnosis and treatment, often needing referral for ultrasound, intensive care, maybe surgery.
Whereas in deer or elk,
Colic, or more often sudden death in a farmed deer or elk, is usually a red flag for a herd problem. The main diagnostic tool becomes the necropsy, and the goal shifts to making immediate changes in feed or vaccination to protect the rest of the herd.
and the primary causes themselves are worlds apart.
Completely. For a colicky camelid, you're thinking C3 ulcers, bezoars, obstructions first. For farm cervids, the urgent things are those acute metabolic disasters, grain overload, enterotoxemia driven by diet mistakes.
Even the most useful diagnostic tools are different. Right. For a live camelid, ultrasound is invaluable. For farmed cervids facing sudden death, the most valuable information comes from that post-mortem exam.
Looking ahead then, what are the biggest needs? Where should research or clinical management focus for these groups?
Well, for camelids, a big one is finding effective, easy-to-administer oral medications for C3 ulcers. The current injectable options are effective, but can be costly and impractical for owners long-term. Also, refining surgical techniques and post-op care could definitely improve that guarded prognosis for surgical cases.
And for the farmed cervids?
Developing cervid-specific vaccines would be a huge step forward. Right now, we rely on products labeled for cattle and sheep for things like clostridial diseases. More research into stress ulcers and better ways to diagnose diseases before death would also be incredibly helpful for managing these unique animals.
So we've really unpacked how colic, while it's this universal sign for belly pain, plays out so differently. The manifestations, the root causes, the best way to manage it, it's profoundly species-specific for camelids and cervids.
Tied directly to their distinct evolutionary paths in anatomy.
Which just highlights why that species-specific veterinary knowledge is so absolutely essential, isn't it?
Couldn't agree more.
Okay, so here's a final thought for you, our listener, to chew on. We've seen these stark differences in vulnerability, from the individual alpaca stressed into an ulcer to the entire deer herd potentially wiped out by a sudden diet change. What can this teach us about that really intricate dance between an animal's basic physiology, its environment, and its diet?
It's a complex interplay.
And maybe how might thinking about these specific differences encourage you to look for the subtle but critical distinctions in other complex systems you encounter, maybe in your own life? Realizing that often a one-size-fits-all approach just isn't the most effective path.